Thank you guys for coming today to learn more about ADHD, which is Attention Deficit Hyperactivity Disorder. This presentation will be recorded as it's for my business and professional communication class through Buena Vista University. First of all, what is ADHD? Some of us might have heard the terms ADD, ADHD in the past, and as of now, according to the Mayo Clinic, Attention Deficit Hyperactivity Disorder is kind of the umbrella that covers both of those. They've eliminated the term ADD and broken it down into 3 subcategories. It's a chronic condition that does affect millions of children, and for some it continues into adolescence, high school, and even adulthood. The 3 areas that it branches into are difficulty sustaining attention, hyperactivity, and impulsive behavior. Something that is interesting that more and more studies are saying now is that some of the symptoms must be present by the time the child's 7. If they didn't have any symptoms until they're 13 or 14, then it's probably a different diagnosis we need to look at. I think many of us have seen the surveys that we have to fill out from a psychiatrist or a doctor when they are suspecting a child might have ADHD. They're looking to find out if the student is really struggling with inattention or hyperactivity. These are some of the signs and symptoms they look at for inattention. If the student's constantly making careless mistakes, doesn't seem to care about the details, has trouble just paying attention, doing simple tasks in the classroom, seems not to be listening when you're having a conversation with them, difficulty following through with tasks, completing homework as assigned, they're not organized, just has trouble focusing. Anything that sustains mental effort, you put a 5-page paper in front of them, they really struggle staying attentive long enough to complete that. Frequently loses things, distracted easily, and forgetful. This is the other side of it, the hyperactivity, impulsive, which is something that I think we are more apt to notice if they're fidgeting and squirming a lot, struggling to stay seated, constantly feels restless, hard to stay quiet, always on the go, always doing something, always busy, talks excessively, sometimes especially younger children. If a teacher's asking a question, they might blurt out the answers before the teacher even finishes asking the question. And they may not have the ability to have proper conversations, whether it's with their peers or with their instructors just interrupting. Something that I thought was very interesting was there's a recent study that suggested a high school student with ADHD has about 70% of their age the ability to make decisions or emotional judgment. So an example of this would be if you think about a 16-year-old child with ADHD, it's very comparable to that of an 11-year-old. So when you think about somebody going to get their license, and you look at a 16-year-old and then you look at an 11-year-old, that's kind of the decision-making difference that is going on inside their brains for an ADHD student. Back to the symptoms, boys and girls do tend to have different symptoms, and this isn't always, this is just the majority. Boys are more likely to be primarily hyper, where girls are oftentimes more overlooked and less often diagnosed because they tend to be quietly inattentive. They may daydream or get sidetracked, but it's not as visible. Boys also tend to be less compliant. They don't necessarily have that desire to please the adults as much as the girls do, so their behavior is often considered more conspicuous. This part, there's no cut and dry explanation for ADHD. There's a lot of research going on right now and a lot of possible causes and theories that do exist. One thing that they have proven is that there is brain difference in the anatomy between ADHD students and regular students. In particular, the size of the brain in ADHD students is smaller than that of a normal student, especially in the frontal lobe, which is up here, and that is where a lot of your decision-making abilities, your rationale, your reaction, all of that takes place in that part of the brain, and it's proven that that is smaller. Another part of the brain is that in ADHD students, there is less, forgot the word, endorphins produced in their brains. So a lot of times they'll be on medications which are stimulants created to increase the production of endorphins. And this they have seen multiple times through MRIs, imaging, different ways they've looked at that. They have proven that there is that difference. Heredity, they know that if you have a family member, you're at a higher risk for having ADHD. Speculation about maternal smoking, drug use, exposure to other toxins, alcohol, or even the child being exposed to these things like blood pain as a young child, they may potentially increase the risk for ADHD. A very questionable theory is food additives. They have looked at like food coloring and things that they put into packaged foods, how that may also increase a child's risk of ADHD. Along with ADHD, there's the potential for coexisting conditions. Oftentimes, the students are feeling very frustrated, which is why there's that animated graphic, but there's learning disabilities tend to go hand in hand with ADHD. Sometimes you'll see oppositional defiance disorder or conduct disorder, which is a severe form of ODD. Sometimes the students get depressed or have anxiety, and a lot of times that's just related to the feeling of being different, the lack of control that they have. If it's untreated and they still have these conditions when they're into adulthood, sometimes they turn to drugs or alcohol to treat their symptoms. There are a variety of treatments available for this. Medication is the most commonly used form as it's the most inexpensive. And as we talked about earlier, the primary med is stimulants to increase the endorphins. A lot of research questions how effective it is, if it's the best approach. One study even said that they feel that medication is more beneficial for the teachers or for the parents just because it tends to quiet the child down. It doesn't necessarily alter any functions or change how the child feels about themselves. And another problem with medication sometimes is that it's not long-term effective. Like if they took their pill at 8 in the morning, if they don't have a second dose during the day, their meds might be worn off by 1 o'clock. There's behavior and cognitive behavior interventions where the child can go to therapy and learn different ways to think about things. They have found that these are most effective if they apply them in real life, whether it's at an activity or in school. They need practice applying their ways of changing their thought process outside of the clinic. If it just happens in the clinic, they haven't seen a lot of success with it. Parental and educational interventions have, again, the potential to be successful, but they really suggest that you have to work as a team with the doctor, with the parents, and everybody has to be on the same page if we want to have the most positive outcome for the students. I talked to all the students that I knew of that have ADHD at the high school, and every single one of them said their symptom that they struggle with the most is just paying attention. They also all have or continue to use medication as their treatment, and most of them said they struggle with sitting still. And I have had a couple, and as well as a parent of an ADHD student, say they sense teacher frustration. I think a lot of times from what they shared with me, they feel like they're labeled as a bad student, or the teachers just don't understand why they're misbehaving and think that they're being disrespectful when really they just are acting so impulsively they don't realize that they're talking out of line or being more fidgety just because they have that lack of control. I found this quote from a student online, and and I thought it was relevant. It just says, ADHD is a real disorder. It causes me to forget things, to be impulsive, to act without thinking, to lose track of my belongings, to be inattentive, and sometimes it causes me to process information a little more slowly. I do not like being different and would very much like to be normal. So I think it's just important for us to remember that regardless of this disorder or disability, however you want to look at it, we've got to remember they're just students and how to help them be successful too, because with or without a label, every student just wants to be respected, accepted, and successful. Are there any questions?